Welcome, learners, and today for our session, let's talk about care of the patient with delusions.
I've gotta do, so I'm not crying.
Now, as always, let's begin with a specific functional concept. So when you say functional concept, it's actually either a word, a phrase, or a sentence that provides you a guide in deconstructing a question. Now, for this concept, we'll be talking about the definition of delusions. So delusions refer to fixed false beliefs not consistent with reality. Okay? So you have here a keyword, false belief. These are actually beliefs that the patient, usually with psychosis, will hold as if it's true for them. However, when it is examined side by side with what is real, then these beliefs are no longer consistent with what reality presents. So, in essence, when you have a patient with delusions, it doesn't make sense arguing with the patient because for them, look at this word here, it is fixed. It's something that they really believe on. So the key is to reorient the patient to reality in such a way that you are not actually trying to tear down the false belief because for them, it serves a purpose. It's their way of protecting themselves from harmful factors, specifically psychological factors in the environment. Okay, so let's move on. So what are the common types of delusions? We have delusions of grandeur, which we usually found in patients with bipolar disorder, specifically manic patients. They would believe that they are important. They have bloated self-esteem. Like somebody could hear somebody saying, I am the Queen of England. I am the King of France. Okay, bow down before me. Okay, these are the people who are deep inside depressed, but since they are trying to compensate for that feeling of depression, then they try to put up a grandiose front. And in essence, once again, this is aligned with the definition of what a delusion is. So a delusion is a fixed false belief. Okay. Now, we also have persecutory delusions. We actually find this in patients with paranoid disorders. In paranoid disorders, they usually believe that people are spying on them, that they are being mistreated. And so they usually would call on the police or the authorities to report something which they believe is happening, but in reality is actually not there. So that's delusion of persecution or persecutory delusion. Okay. Then we also have somatic delusion, which is usually found in patients with schizophrenia. Now, somatic delusion is usually manifested by patients saying that their internal organs are decomposing such that they believe that this is really happening. And so they get alarmed, they get anxious. But in reality, when they undergo laboratory tests and procedures, it would be found that usually their internal organs are indeed intact. Okay, so it's a part of the psychotic manifestations of schizophrenia. Okay, now, so let's move on. So here's another functional concept. In a patient with delusions, the appropriate nursing diagnosis is disturbed thought process. Now, how are we going to use the concepts that we just learned about delusions? Here's a sample question. A client diagnosed with schizophrenia tells the nurse that his stomach is disintegrating. Now, this is the key word here. The stomach is disintegrating. That has to ring a bell for you. We've just taken up the 3 common types of delusions. So the nurse knows that based on this behavior, the appropriate nursing diagnosis is it disturbed thought process, ineffective individual coping, risk for violence, other directed, or disturbed sensory perception. Now, disturbed sensory perception is usually associated with hallucinations, whether it's auditory, visual, or tactile. Risk for violence, other directed, this could actually be common in patients with escalating hostility, anger, or anxiety. They become restless and become violent. Now, ineffective individual coping is more appropriate for patients undergoing a crisis in which their habitual coping mechanisms usually fail. So the best answer, as we said, is disturbed thought process. I just hope I was able to clarify that for you guys who are preparing for the NCLEX RN. And this is your mentor Ray once again telling you a functional concept a day keeps your NCLEX RN fears away. So I'd like to invite you for more instructional videos. Subscribe to my YouTube channel, Gapuz Mentors, and my Facebook page, Mentor Ray. And if you want me to cover some of the concepts in which you may need some clarifications or you need to be simplified, please do send in your request to my email, mentor.raygapuz@gmail.com. And here's a disclaimer. This instructional tool is created to enable students to develop their test-taking skills. The question or questions and the answer or answers contained in this instructional video were patterned after the official publicly accessed samples from the RN test plan of the National Council of State Boards of Nursing, or NCSBN. The discussions and rationale presented in the video are based on the lecturer's research and are meant to provide an explanation for the answer or answers to the question or questions that is or are presented. The lecturer makes no claim, directly implied or otherwise, that the rationale discussed is officially endorsed by NCSBN.